born too small, too soon or too sick or requiring surgery shortly after birth. So what happens if my baby is born too soon, too small, too sick or may even require surgery shortly after birth? Did you know there are around 750,000 babies born each year across the United Kingdom? Approximately 95,000 of these babies, 1 in 8, will require various levels of neonatal care when they are born. Dependent on where mum is booked for their maternity care, will determine whether the baby needs to be transferred to a specialist centre to provide ongoing care or surgery. Although mums have a choice where to book their maternity care and where they wish their baby to be delivered, unfortunately, neonatal care is limited to a few specialist centres, and should your baby be born too soon, too small or too sick, then it often results in some babies being transferred between hospitals to receive specialist treatment in these specialist centres. So what are the different types of neonatal centres across the United Kingdom? These are grouped into neonatal intensive care units, local neonatal units, special care baby units and surgical centres. Neonatal intensive care units provide the highest level of care to all babies but specialise in caring for the smallest and sickest babies. This includes all babies needing breathing support or weighing less than 1,000 grams at birth and or less than 27 weeks gestation. All those babies who become ill during birth or have heart or surgical conditions detected antenatally who may require any intensive care facilities. Local neonatal units. These units provide a high level of care, but the babies are not so small or sick. Breathing support can be provided and other treatments such as intravenous fluids for babies too ill or too small to feed by mouth. These units provide care for babies born after 27 weeks gestation. Special care baby units. These units will provide care to babies born more than 34 weeks gestation, including tube feeding, oxygen therapy, treatment for neonatal jaundice or infection. Standalone maternity-led units. These units are managed and staffed by midwives, often known as birth centres. They offer care to women with straightforward pregnancies who are at low risk of developing any complications during labour or birth. But if specialist medical care is required, the baby will be transferred to a consultant-led hospital that can provide this care. Surgical units. Some babies may require surgery after birth due to being born too soon. Some babies may have had an antenatally diagnosed surgical complication, which also requires treatment in one of the specialist surgical centres. Babies are usually stabilised after birth on the neonatal unit prior to the transfer to the specialist surgical unit. Some babies may also be transferred back to those referring neonatal units following the surgery before they go home. If your baby needs to be transferred between different levels of neonatal units or specialist surgical centres, this will be done by a team of highly trained medical and nursing staff. Your baby will be transferred in a transport incubator by ambulance. Although it is not ideal to have to transfer very sick or preterm babies from hospital to hospital, it is usually time critical that this happens for the safety of both the mom and the baby, and this can sometimes lead to parents being separated from their baby for days. Neonatal units and specialist surgical centres from neonatal networks across the United Kingdom. All networks will provide the different levels of neonatal units and specialist surgical centres, and wherever possible these networks will try to have babies' care delivered closer to home, but this has its challenges with increasing birth rates year on year and a lack of available neonatal cots or adequate medical or nursing staff to provide these specialist services. It is not ideal to transfer sick or preterm babies from hospital to hospital to receive any specialist care, but it is necessary to ensure patient safety.